Stroke. It's a word that isn't used lightly, and for good reason. Chances are you know someone whose friend, colleague, or family member has experienced the devastating occurrence of stroke. That is why companies from across the globe are working in the fight to help individuals of all kinds survive and recover from the detriments of traumatic brain injury. I'd like to introduce you to a special company whose work stands out from the rest, BioxyTran. What is a stroke? A stroke occurs when blood flow to a part of your brain is blocked. After not receiving oxygen, after just a few minutes, the brain cells suffocate and begin to die. This is where things get dangerous. If the blockage isn't removed right away, likely with surgery, victims can suffer lifetime brain disabilities and even death. So what are people doing about it now? Scientists like Dr. David Platt, carbohydrate chemist and serial medical entrepreneur, previously founded over 4 companies with inventions all using sugar molecules. With his latest venture, BioxyTran Inc is introducing his newest discovery, BXT-25, to the world. BXT-25 can trace its genesis back almost 80 years. Scientists have tried and failed for decades to mimic the structure of blood. Dr. Platt's common sense approach was to embrace evolution and not try to recreate it like many of his predecessors. He took the smallest oxygen-carrying component of a blood cell, called heme, and stabilized it with a copolymer. In essence, he invented a miniature oxygen-carrying molecule that is 5,000 times smaller than a red blood cell. BXT-25 is currently pursuing phase 1 clinical trials with the FDA. There's a misconception that clots don't allow anything past the blockage. The reality is that a small amount of blood plasma continues to flow through the clot, much like water through a fishnet. This plasma contains a small amount of oxygen that the body can use to reach hard-to-reach tissue. Due to BXT-25's tiny size and its oxygen-delivering properties, it may easily flow through a clot carrying oxygen to the other side, buying stroke patients critical time that can both prevent brain damage and even death until further invasive measures can be taken. In comparison to other stroke treatments, BXT-25 has a competitive half-life of 9 hours to its competitor's 6-minute half-life. It's stable at room temperature, significantly more affordable than its competitors, and has a chemical structure naturally found in nature, with no man-made additives. In the future, BXT-25 may be administered by first responders through IV in order to promote healing during and after a stroke. This great breakthrough in stroke research and development could help save thousands of mothers, fathers, friends, and family every year. Did you know stroke kills about 140,000 Americans every year? That's 1 out of every 20 deaths. Every year, more than 795,000 people in the United States alone suffer a stroke. That means every 40 seconds, somebody has a stroke. And that means every 4 minutes, somebody dies of a stroke. If it's not treated at the hospital immediately, after just 2.5 hours, your brain can age up to 9 years. But BioxyTran needs your help. As a growing company, it needs help from investors, individuals, and people that care, just like you, to help make sure that brilliant scientific developments like BXT-25 make it to the surface. Visit www.BioxyTranInc.com to find out information about how you can help ensure BioxyTran can help save lives. Tell us your story about how stroke has affected your life, and see how you can contribute to help make a difference with advancements in stroke therapy with BioxyTran. At BioxyTran, we'll be there when every second counts.